talking about today, and I really wanted to talk mostly today about arthritis, hand arthritis, finger arthritis, pain in general. So I get a lot of patients that come with arthritis and they are pretty hopeless. They've decided there's nothing can be done, and that, the doctors have told them you've got advanced arthritis, this is it, you're just gonna have medicine. But this is actually false. There's a lot of things that we've told our patients for many years that are actually very, very false. And in 2016, I started video recording my patients, and over that period of time, these many years, I've discovered a lot of things about pain that are misnomers, that we're actually wrong about. So one of the first things I wanted to tell you, if you have arthritis, these are very cheap ways of helping with your pain, okay? And if you came into my clinic, the number one thing I would tell you about first is vibration. And this is a tiny little vibration ball. It's running now, it has a little light on it, and you just plug it in, okay? And so when that is on, you wanna take that, you want a light setting, and you want to take it and you want to rub it wherever your pain is. So mostly we have thumb pain problems when we talk about arthritis. So people have so much pain with their thumbs, and what they're thinking is that it's an advanced joint spacing problem. But a lot of times people have a diminished space, and the cartilage is still okay, but they have an extreme amount of pain. So we're assuming it's a joint problem. I'm here to tell you the joint is not where you're feeling the pain. It's actually in the nerves. So pain is in the nervous system, which is really confusing for a lot of people because it feels like it's in the bone or the joint or down deep in the muscle when they activate the muscle. But the pain receptors, most pain receptors are over the top in the skin. So it's literally sitting on top of the joint. So if you have a joint that's enlarged and bigger, like a thumb CMC joint, then if the skin is tight over that, this is where a lot of the pain is coming from. Now, people are gonna dismiss this and think that this is untrue. But again, I teach on pain, I teach around the world on pain. So I wanted to show you the things that I would recommend you doing. Again, the very first thing is to get a vibration ball. Now, what's interesting about the nerves in the hand, that most of the time people complain of pain right here, or sometimes on the top, or just generally the whole hand hurts, right? So the nerves that do the top of the hand and the thumb all come into this section. They come up the side of your wrist and exit right up here, okay? So that means when you take your little ball, you can take it up here and roll it and vibrate it. This is the very first thing I tell my patients to do when they walk in their door walk in my door and get to come in and have therapy with me. Also, what's interesting is, so the nerve that is right here is the same one as on the top. And so a lot of times people complain of pain from here to here. If the pain is a little bit lower in this muscle, this particular nerve comes up from the elbow as well. So this is why a lot of times in the morning, you feel stiffer and more painful after you've gone to sleep and you bend your elbows. So again, take the vibration ball, start up here at the elbow, then go down a little bit lower, and anywhere where it feels good. Most of the time people are rolling it all the way through this section and it feels better. So the thing about pain that people don't also understand is pain and temperature go to the brain on one pathway, and everything else, pressure, vibration, touch, light touch, all go on a different pathway to the brain. So if we want to override this pathway, we need to give it something else to concentrate on. The brain needs to think about something else. So what's fascinating is vibration, very light vibration, not the hypervolts, not the thumping ones. Very light vibration will get to the brain faster than pain. So that means you can use vibration anywhere. You have back pain, you have hip pain, you have knee pain, or you have pain during therapy, like somebody's ranging your finger and it hurts. Take something that vibrates and put it above that. Your brain is going to focus on that. So for us, we have a lot of things in here that vibrate. So if we were using this larger ball, this is a really nice one for back and wrists and stuff. This actually heats up, and I can post a link for what it is. We actually put this underneath a heat pack. So heat is something that your body really likes when you have arthritis. So a nice moist heating pack and vibration is a double whammy. So people really like that. We have, again, some other versions. We have this little nice version. I can post the link on all of these. These ones are actually a little bit cheaper. And they come as a set or a pair, and you can put them in a sleeve for your back. They're technically for backs, but this is like $8.99 and this is about $22. I tell you, patients, usually arthritis patients really like this one because they can not have to hold it. They can just roll it with their other fingers, so they don't have to hold it with their hands, which is a big deal because, if you've got arthritis in one hand, you probably have it in the other as well, okay? So that's our number one tip. Our number two tip is this. Let me get it. So our number 2 tip is poly pellets, okay? These are fantastic for pain and keeping range of motion. So what you do, and I'll make another video of this plastic, is what you do is you put your hands in this tub of plastic. You can get a big tub. Let me show you what we have. So we have a big tub of plastic, and we get our patients to put their hands in there and start exercising just gently. You really are just working on doing the movement through it. You don't even have to do anything repetitive to start with, but it's cool and it's soothing. And now on that same pain theory, you know, if we say we're giving the brain something else to concentrate on, this is a really nice thing to concentrate on. And you can do a heap of exercises with it to keep your joints moving and limber. And then this is just a really nice way to feel better. So this is our number 2 thing that we tell our patients. So another thing that can help is this little block of foam sponges, right? So I'm going to show you how to cut it up, put it between their fingers. Everybody should get the wedges as well when they have thumb arthritis or finger arthritis, because there's so many sensory nerves on the top of your hand, and when people have pain, they kind of clamp their hands in, and then it kind of crushes these little nerves that run outside the web spaces of the fingers. So let me get a thing and we'll... So it doesn't seem like it would make a difference, but it makes a huge difference. And another big deal is because the index finger and the thumb will kind of conjoin at the base right here. So when you move your index finger, even if it shifts out to the side, it's going to make the pain worse. So a lot of times people have index finger pain as well. And if you're pinching and do a lateral pinch, like, it just hurts. So if you test on a patient and they have a lateral pinch and it hurts, put your fingers between there and ask them to laterally pinch again. And if it doesn't hurt, then you know we need to space this over, because it's the hinging of this nerve going over that radial collateral ligament right here that causes a lot of the problems. So here's how we cut them. So I just eyeball it. It's usually about 1 inch. Okay. And then you cut it in half again. And obviously when there's 3 of them. Okay. So then I take it and I have my curved scissors. Now, if you don't have access to these sponges, that's fine. You can go ahead and get like maybe a washing up, a car washing sponge, like the big kidney shaped ones, and then just cut them up. You want to have enough density that it keeps your fingers apart, but not so much that you can't squeeze them, right? So make this straight. So, and then I take this wedge and I fold it over my finger, and I actually use the curved scissors and I point them down, which is a bit unusual, but they usually work out that way better. You get a better edge this way, or a better curve, I guess. All right, and I'm going to make 3 of these to put between my fingers. And so once you've got all of these wedges in, then now you can ask the people to move and they'll feel so much better. Like for any hand arthritis, any hand pain, this is absolutely 100% what you want to do, okay? So this is something I invented. They don't cost a lot of money, and they do a miraculous job on your hands. So let's cut another one. I'll show you how I would now proceed and use tools. So people get a little confused about using tools, which, and a lot of patients are a little bit scared to do that. Hang on, let's just make this last wedge so I can show you how this looks. Okay, so now we've got 3 all between the fingers. Now, a little tip is if this one is too wide, it might make this finger achy. So you might either keep it out or just make it thinner, all right? So now we've got our wedges in. People's hands should miraculously feel better. So for anybody with hand arthritis or hand pain, this is what I would tell you to do. Okay, this is going to make it feel better. You want them on both hands, and you want to move as much as you possibly can with them on. You don't have to wear them all the time. You just take them in and out when you want. But again, this is be the 3rd thing that I would do if somebody came into my clinic with arthritis or hand pain, and I'd be like, okay, we're going to make wedges. So the next thing that I would do is use chip clips. Okay, so this is a great little life hack. This is from an article written by my friend Virginia O'Brien, and this has been around for a long time, this concept, but I use it slightly differently. So when somebody has pain in their thumbs, usually there'll be an imbalance with these muscles, and the joint alignment now changes, and a lot of times this muscle is quite tight. So this is a little trick where you put it on there and you let it relax. Okay, it helps relax the muscle. Now, I look at this slightly differently. I think in superficial layers first. So for me, when I put it on, I see the skin glide ever so slightly. And if you looked at the sensory pathway of these nerves, the nerves run right over these bony prominences, over these joints. So they have this tendency for the skin where the nerves are running to get stuck, right? So this chip clip is nice because it helps glide the tissue distally. And some people, they can only wear it for about a minute or so, but the goal would be to wear it a couple of times a day, about 2 to 5 minutes. If they don't like it at all, that tells me then the system is really already very adherent, and we've got to do some other things. We've got to go back to the vibration a little bit, but I'm going to show you what to do with tools as well. Again, patients can do this on themselves. This is a great thing to do at home. You don't have to go into therapy for this, but if you have like a really bony change or an alignment problem, you really need to go see a hand therapist. So they will be able to help you with that. But so anyway, we do this. So I can see this is gliding that tissue distally, and if the patient likes it, then I know I'm going to do tools that are going to go distally, okay? So we're going to discuss tools. Hang on a minute. So this is what gets confusing for people when they see a lot of my videos on tools. So what we're looking for is a very fine edged tool, really, really small, right? This is the pottery tools that you can get at the craft store, like Michael's or Joann's. But you can get, if you want something a little bit more medical grade, you can get esthetician tools. As long as you have a very fine edge, you want to free up the skin as easily and delicately as you can, okay? So you want to use lotion. I'll just demonstrate without lotion. And I'm going to take my tool and I'm going to just gently pry away all the skin from these creases, right? When you get down here, you're going to notice this will be more swollen, especially in this little section, because this is also SPRN. But you want to get in here and free up the skin in the smallest strokes possible. So most people do tools and they do these great big tool strokes. That's not the way it works. The sensory system is very refined in the hand, and you want tiny little strokes. So you want to free it all the way up in all directions, but if they like the chip clip going this way, then your direction that you're going to free up is going to be this way. And think about the nerve. The nerve is going to get caught in the tissue. Like, it's right on the skin. It's above the tendon. So if you see a tendon, so you can even see on me right here, right? So my skin is adherent to this tendon right in here, all right? It doesn't hurt, but if it got tighter and I didn't keep it loose, or I overused my thumb, that could be the point where my pain is coming from. So I would take a tiny little tool and I would free up that tissue. And we're talking light strokes. You're only trying to free up the skin. So you can do that over nodules, like right here at the edge of the thumb, right at the index finger, lotion, won't get lotion, but free up in all directions, not just distal, proximal, opposite, back and forth, any of these directions. But if you do one and it hurts, don't go that way. Okay, we're not trying to cause more pain. If it hurts, it's telling us that's where the nerve branch is stuck, right? It's stuck behind the bone usually. So there's little painful nodules, give people so much trouble, but they shouldn't. You just got to get some lotion and a tiny fine tool and kind of free up the skin. It's very easy to do, and nobody knows about it, right? Nobody knows. This is something that I've developed over many years, and I really wanted to put it out there to help with arthritis patients. So that's pretty much what it looks like. And the first time they walk in my door, these are the first things I tell them. I explain to them about the sensory nerves, and that pain is coming from the superficial layer, not that deep joint layer. All right, thanks.